think the hard thing about postpartum is you're falling into a world where you have an infant to take care of. You're navigating all the nuances of having a baby. So like the learning curve is just insane.
Right.
It's huge. And you're living in a body that you're unfamiliar with. It takes a lot of energy and dedication to get yourself back to a certain area, and also time. We are not provided with any resources postpartum. As you leave the hospital, they check your car seat, they check that you know how to do the car seat, and then they're like, and here is your QR code to sign up for your postpartum class. If your pelvic floor is functioning well, you should not be aware of it. When you describe prolapse, it's horrifying.
Right.
You're like, oh my God. If a woman is not able to understand her own issues first, then it's really hard for a partner to support her. And not that she has to tell them how to support her in every aspect. I would encourage women to not shy away from getting into heavier weights. So to buying heavier weights or to trying harder exercises to really see what they can do. Giving yourself the self-care that you would want your children to have. Another cultural thing is like, well, women were born to give birth and women were born to have babies. It is really hard for humans to have babies, especially compared to like other animals. It's big. We have babies have big heads. We have smaller pelvises. It's a big deal.
When we talk about pelvic floor recovery, the conversation often ends with leakage, prolapse, just do kegels. But the healing is hardly that simple. There are deeper layers which do not get spoken, the body that feels unfamiliar, and the intimacy that feels different all of a sudden, and cultural differences that makes women believe that this is the new normal. Today, we'll be peeling those layers as we have this conversation with Tara Campbell. She's a pelvic floor and orthopaedic physiotherapist whose approach blends strength, functionality, and emotional reconnection. She's been helping women to recover not just physically, but also as a holistic human being. Hi, Tara. Thank you so much for joining us today. So let's start with basics. What is pelvic floor and why is it so important during postpartum recovery?
Thanks for having me. Happy to be here. Always happy to talk about the pelvic floor and pelvic health in general. So starting with what is the pelvic floor and why is it so important with postpartum recovery? So the pelvic floor is basically a group of muscles and other soft tissue, so tendons, ligaments, and fascia that make up the soft tissue between the pubic bone and the tailbone and the right hip and the left hip. So it sits at the very bottom of the pelvis, and it houses the pelvic organ. So in a female, that's the bladder, the uterus, and the bowel, and it works with the core and the back and the hips to make us functionally strong and allow us to do the types of activities that we want to do, but it also controls the pelvic organs, so the bladder, the uterus, and the bowels, and it allows in females or people who are born female at birth to give birth to babies through their uterus.
Right. And do women who've undergone C-section, do they experience pelvic floor issues the same way like how a woman or a mom who's given birth to a vaginal birth baby?
Yes. So basically, being pregnant affects the pelvic floor, and that kind of takes me back to the initial question of why is pelvic floor or pelvic health so important in the postpartum phase. So that is true not only for people who have given birth vaginally, but also C-section people, because when you are pregnant, there is a huge change in your physical self, but also in the hormonal aspect as well. And those hormones can bring on changes all on their own, but also like the weight of the baby on the pelvic floor over the 9 to 10 months has an impact on the pelvic floor. The way that your pelvis shifts, the change in your posture, so postural shifts, all of those things can impact the physical pelvic floor itself and the way that it's feeling, along with like the back and the hips and the glutes and all of the other joints and muscles that surround the pelvic floor, because the pelvic floor doesn't work in isolation, similar to any joint, like the shoulder joint's affected by the elbow and the neck. So the pelvic floor is affected by the low back and the hips and the core. And obviously during pregnancy, all of those areas are affected. And some people, they're affected more than others. If you have a history of like an injury, like a back injury before you're pregnant, or if you have kind of intermittent hip pain prior to being pregnant, sometimes those things can be exacerbated during pregnancy and can cause you issues during pregnancy. A lot of people experience issues during pregnancy, such as prolapse symptoms, so pelvic heaviness, incontinence, urinary or fecal incontinence. So there are issues or there are changes that are very prevalent during pregnancy for a lot of people. And most people experience some level of back pain or pelvic pain as well. And all of those issues a lot of them can go away postpartum on their own, but for some, they linger on postpartum as well. So the act of being pregnant affects the pelvic floor. And then even if you've had a C-section, maybe you went into labor spontaneously, naturally, but then ended up having an emergency C-section. So you could have effects of labor and then have a C-section. And even if you have a scheduled C-section, then, like I said, the pelvic floor doesn't work in isolation. So it's affected by core strength and core coordination. So the pelvic floor and the core, they are coordinated together, or they should be ideally functionally. So if you've had a C-section, there's obviously there's been trauma to the muscles of the core, and ideally you would need to reconnect the core to the pelvic floor. So do core recovery as well, so that everybody's kind of sharing the load of functionality and functional strength, so that you don't have issues show up later on. And actually, statistically, urinary incontinence ends up being just as big of an issue for people who have had C-sections as it does for people who've had vaginal birth in the long run. So that just shows us that the pelvic floor is impacted by not only delivery type, but also being pregnant as well.
Right. Often new moms, they convince themselves that this is just part of postpartum recovery. And when is the right time for them to approach a pelvic floor physio? Do they have to wait until postpartum, or is it good for them to like approach them while they are pregnant?
I think in an ideal world, everybody who's pregnant would get a pelvic floor assessment done, not even just to fix issues or to help with pain, which you can do, but to prepare to kind of connect to the pelvic floor, or to deal with issues that they might have been dealing with even before getting pregnant, so that they don't become worse during pregnancy or in the postpartum phase. So many people who see a pelvic floor physiotherapist have never been pregnant before, and they're not currently pregnant, and they're still having issues with it. Or maybe they're coming prior to becoming pregnant because they're worried that when they become pregnant, the issues that they're already experiencing are going to get worse. So that's a really proactive approach. And I think proactive therapy is so effective. It's sometimes can take like 1 or 2 sessions to see meaningful change.
Right.
Whereas if you wait for problems to progress to a point where you just cannot deal with them anymore, it can take longer to get to where you want to be. So I'm always a big advocate for proactive therapy, or dealing with things before they become an issue. And that being said, so in an ideal world, you see a pelvic floor therapist if you have issues at all outside of being pregnant, during pregnancy, and then any time postpartum. So I always tell people, like, there is no time limit on seeing a pelvic floor therapist. People come into the clinic and they'll say things like, I want to address my pelvic heaviness, or I want to address my incontinence because I don't want to end up like my mom. My mom has such hard issues with it. And I'm like, bring your mom in.
Right.
Like, your mom deserves a pelvic floor therapist, because there is never a time where it is not effective. or
Right.
it can't bring about change. So I think that's a really important message for everyone to know, is that it's never too late to change your pelvic health symptoms. That can include incontinence, again, urinary or fecal, so leaking, pelvic heaviness, low back pain, chronic hip pain. Like a lot of women, especially like in the menopause, postmenopause timeframe, will get like chronic
Right.
lateral hip pain. That can be contributed by the pelvic floor. So, but I think like leaking is one of the major ones that women tend to talk about a lot. But because it's so common, people find comfort in knowing that it's common. I think I would like for people to understand that it's common, but then to have access to resources to be like, that happened to me too. But then I did this, or then I saw this person and we addressed it,
Right.
instead of being like, oh, well, thank God it happens to everyone else I know, and then just living with it. So normalizing is good because it brings comfort, but normalizing it and then not having any actionable
Right.
way forward is harmful as well. So that's kind of my passion as a physiotherapist, and is why I'm on social media and
Right.
like have started my own online company, because I want to increase the number of resources that people have access to, so that they don't have to just live with it,
Right.
because so many people do. Yeah.
That's such a powerful message. Yeah. I remember my mom telling that she experienced severe back pain, like you said, during her menopause, when she
Yeah.
was
Okay.
going to enter into that phase. And we're going to go a little deeper now that we covered the basics. So when we talk about pelvic floor, it's not just physical. It holds stress, memory, or sometimes even trauma. So, what role does emotional regulation play, or how does that show up in your work?
It shows up quite a lot. I think, as you can imagine, as a pelvic floor therapist, there's people coming with all sorts of histories of either injury, but also things like sexual abuse or trauma related to labor and delivery, or just long-term issues, sports injuries, stuff like that. Those kind of things they're all important and relevant in like a pelvic floor assessment. And regardless of what the culprit is, the pelvic floor, or addressing the pelvic floor, is like a delicate matter. So I feel like I'm straying, but it shows up in all sorts of different ways. It shows up in the way that somebody like responds to questions about their symptoms. So navigating people's emotional response to certain questions that I ask, which is important for me to find out. You can't always just dive in all at once. You have to slowly approach some things. You always have to ask for consent, not just verbally, but like physically as well. So sometimes people are like logically ready to address an issue, but physically, when we start actually getting into it, I can tell that they're uncomfortable. And so we have to go slower, or we have to kind of divert the path to other issues and work our way in slowly. So it shows up in all sorts of different ways. Oftentimes people will come in not for a pelvic issue, but then it becomes evident that they also are struggling with other pelvic issues. And that is most likely contributing to the issue that they came in with. So for example, like hip pain or back pain, or even like knee pain. I've had people come in with knee pain, and when I'm assessing them, I'm like, this is not a knee issue. This is coming from the pelvis. And then we start talking about the pelvis and the hips and their pelvic floor. And then all of a sudden we're treating them for like painful sex, or like the fact that they can't use a tampon because it's too uncomfortable. And once we start treating that aspect of the body, their knee pain goes away. So that can be, to them, they're like, I never even considered the fact that I could have pelvic floor dysfunction. They've just been like dealing with it or like repressing it because they haven't really known anything different. So it comes up every day, almost in every pelvic floor assessment, because even if you've had a baby and your labor and delivery was pretty standard, pregnancy wasn't too awful. I mean, it's long and it's hard for everyone, but no major medical issues. If they're sleep deprived, if they have a colic baby, their day that day can impact how they're showing up to the appointment, and kind of the stress that they're holding overall. And so many times postpartum women will cry in our appointment, like right off the bat, because they're just
want to release
it. They need a release, and they're just like holding on to dear life. And, like I invite them to cry, like I would cry too, for sure. It's healthy to cry, but that's just telling me that, they're having a hard time, and that, will shape our assessment. It will shape what we do that day. Sometimes people just need to lie on their stomachs and like have a low back assessment and have me treat their low back. So they're coming in for their postpartum checkup, but actually they're having a lot of low back pain. And I'm like, out of all the things that we could do today, what's going to make your day the best? And sometimes they just need to lie down and have their back pain feel like 10% better. And so that's what we do. So it shows up in all sorts of different ways. I treat chronic pain a lot as well as an orthopaedic physiotherapist. And so I find that my background in chronic pain has lent a lot to pelvic health, because it's not like treating a sprained ankle. It's so affected by everything in your life. So I think those two kind of is maybe what got me into pelvic health as well, is like my background in chronic pain, and really kind of like settling people down so that you can like help build them back up a little bit.
It's very powerful. Yeah. And in many communities, pelvic floor is still considered like a taboo topic. And how does this shape the way women approach their bodies and recovery process?
It's a good question. I think one of the things that pelvic floor therapists are really good at is asking tough questions or talking about like having challenging conversations that for many people, they've like never had these conversations before. And I think that comes with practice. And again, I'm not like a super experienced pelvic floor therapist by any means. I'm still kind of like a baby pelvic floor therapist. The other day I realized that I've been a physio for 10 years, and that was, I was like, oh my gosh, I feel like it's been 2, but it's been 10. So pelvic therapists are really good at asking really hard questions and doing it in a way to hopefully make people comfortable sharing the answers to those questions. And depending on how somebody responds to that, you can get a sense of maybe what conversations are like in the home as well. And I think a lot of patients have the answers to their own questions, as long as you kind of give them a platform or an opening to talk about it. So my job is to help people basically like help people find the answers to their own questions by asking the right questions. So it's a big question because there's so many cultural differences, not just like within like different religious beliefs and stuff, but also just within every family and every relationship in that family as well. So it's a big question. I think providing information and education and breaking complex things down into digestible pieces of information basically just gives the patient information that they can then work with. And then I ask questions about what they want to do with that information, and then they can tell me how much they want to go down one route, but
Right.
it can be like a daunting conversation to have. So working through things slowly and not kind of bombarding people with everything all at once can help them guide themselves to what is really important for them in that moment. I hope that makes sense.
No, it does. It does, because it kind of resonates with me. How like I just went through the postpartum phase. I'm still going through it.
Yeah.
And there's a rush to bounce back for new moms who are navigating the postpartum phase. And as a pelvic floor and orthopedic physiotherapist, what are some of the deepest belief or patterns that you see? What's responsible for them to rush through the process? They want to bounce back. So what's pushing them to it?
I think that's just a commonly held belief everywhere, not just in pelvic health or postpartum. As a physiotherapist, especially somebody like an orthopedic therapist, people have a really hard time accepting the passage of time as part of their recovery. So even if somebody has like a bad knee injury, if they're looking forward and they know that that's going to affect like even like a tennis tournament they have coming up, or returning to certain activities that they love and bring them a lot of joy, for some, accepting that their knee pain, like I can help them, they can do exercises, they can do healing, like things to help with the healing themselves at home. But depending on the level of injury, like the need for time to pass so that your tissues can heal is a major component. And so it doesn't just show up in the postpartum world, it shows up in every aspect of physiotherapy for me, at least anyways. Prior to working at the clinic I'm at now, I was working at a sports medicine clinic. And I found that was a really big barrier for a lot of people because I was treating a lot of athletes. And you want to help them get back as soon as you can as well. But for some people, I would spend, a decent amount of time basically explaining that like they can't put their broken ankle into a skate the next day. Like it's just, there's nothing that you can do to make it heal faster at that stage. So I think culturally that's just prevalent in many areas. I think the hard thing about postpartum is if people who have never experienced like a major injury before, they've never had to go through a recovery process like that before. So for myself, I think like before I went into kinesiology, before I went to physio school, I tore my ACL and my meniscus pretty bad when I was in grade 11. And so I learned that in high school because I basically refused to believe that I had to wait as long as they were telling me to wait to get back to sport. I was like, I can do it faster. I'm going to go to the gym every day and I'm going to make this better faster. And I couldn't. Like you can't.
Takes a toll.
And it takes a toll, and it takes a lot of energy and dedication to get yourself back to a certain area, and also time. So if you've never experienced something like that, now you're falling into a world where you have an infant to take care of. You're navigating all the nuances of having a baby. So you're like, the learning curve is just insane.
Right.
It's huge. And you're living in a body that you're unfamiliar with, and it's like leaking everywhere and like out of all sorts of areas. And none of your clothes fit. And, you just want something to feel like yourself again. Like you just want something to feel like you have control over it. And so I think some people are using postpartum exercise and stuff so that they can get their body to feel more like it used to, but also so they can like do the things that bring them joy. So I think that's one component. And then also just the fact that basically we are not provided with any resources postpartum. So
That's
they're like, there's this 6-week follow-up with your OB or your midwife, and that is it. So then that gives us the illusion that at 6 weeks, it's like, oh, everything's good. Now you should be
Back to
fine.
normal.
And it's like, that is not appropriate. So culturally there in the healthcare system, that's a big problem. Again, that is what has inspired me to work with community clinics so that I can provide like some sort of trying to fill that gap of a lack of resources. So it's like, if you want to learn more about any part of your physical recovery postpartum, like here is something that you can do. I think it should be standard of care. Hopefully one day this course will be offered, or courses like it could be offered. Like as you leave the hospital, they check your car seat. They check that you know how to do the car seat. And then they're like, and here is your QR code to sign up for your postpartum class, because that's what everyone deserves, really. So I think it's multifaceted. The healthcare system needs to do better. Having a 6-week appointment is not enough. And it makes people think that at 6 weeks you should be better. And that's just ridiculous. And then people's need to feel like they're in control of something. And then just like never having experienced anything like this before.
Right.
So yeah, there's a lot of things that contribute to it, I think, a lot.
And what does a realistic return to movement look like? Not just physically, but also emotionally and mentally.
That's a good question. Again, I don't have a straightforward answer basically for any of these things, but it really depends on the person. So we have guidelines now, finally, that help people do certain exercises and activities to prepare themselves for something like running. So a lot of people who ran prior to pregnancy or during their pregnancy, they want to get back to running. Like running is like one of those things people like need to run.
Right.
If somebody shows up in the clinic and they have basically done almost nothing for 3 months, and they are looking to meet and they're saying like, I mentally am struggling so much because I can't run. And I'm like, if you could do anything in the world and it's running, if that's going to like save your mental health, go for a run.
Right.
Like, I'm not going to tell you, you need to check off all these boxes before you go running if like running is going to save your day right now, because sometimes people just need to do that. If somebody comes in and they want to get moving, but they're like petrified of moving, like maybe they had a traumatic C-section and they haven't even looked or touched their scar yet, like helping them become less fearful of movement and like just taking them to the gym and doing exercises with them in that moment so that they feel confident to do that by themselves at home. Like that's what we'll do that day too. I don't need to check your pelvic floor to show you that you can do stretches without harming yourself. So it really depends. It depends on how somebody's doing in that moment, basically. Basically, my answer for most of these things is like, it depends, because that's why it can be so hard and so daunting to prescribe something to a huge group of people, because there's just so many variables that can contribute to their healing that kind of changes the answer for each person.
Right. So it's never one size fits all.
Yeah, it truly is not.
So true.
Yeah.
So women, we look so strong from outside, but sometimes our body is sending, more so, pelvic floor is sending subtle cues like leaking, discomfort, heaviness. So how do you guide or help women to tune into these subtle cues?
I think similar to what I mentioned before is that we are good at asking hard questions.
Right.
Because even if you're having these conversations with your girlfriends around a cup of coffee or something, and you realize that maybe some of the other people that you're with are also are also leaking when they sneeze, or if they cough and they're leaking. Like for some people, they have a really hard time not passing gas. Like they're like, well, it just comes out. Like I have no control over it. and they realize, oh, like so-and-so also is having trouble with that. Like what a relief. The pelvic therapist is going to be like, let's talk about that.
Right.
Like, I want to know the details of that and how it's affecting like your activity day-to-day activities, your return to exercise, stuff like that. So again, overarching message is just like, if you're experiencing these things, if your pelvic floor is functioning well, you should not be aware of it. Like, you shouldn't feel it during sex. It should not be painful. Like, you should just have pleasurable sex.
Right.
You should be able to control your urine. Like, so you should be able to not pee when you don't want to pee, whether that be with running, jumping, skipping, coughing, laughing. But also, like, if your like urgency is a type of incontinence, if you're in the car and the urge to pee comes on so strongly that you're scared that you're going to pee your pants, that's like you're frightened that you are lacking control of your bladder. Chronic constipation, you should be able to have regular bowel movements. They shouldn't be painful. You shouldn't feel your pelvic floor. So heaviness, it shouldn't feel like there's something falling out or that you need to like splint your vaginal wall to have a bowel movement. All of those things, you shouldn't have them. They're not normal. A lot of them are very common, but you should basically have comfortable control over all of those things. And if you're not, then that's a dysfunction of the pelvic floor and you can work on it. Like, because sometimes when I'm teaching my course and I'm talking about stuff like prolapse, when you describe prolapse, it's horrifying.
Right.
You're like, oh my God. Like, basically, for those who don't know, prolapse is like a shift of the pelvic organ. So it takes up space in the vaginal opening and can start to kind of descend down. And like it causes heaviness, discomfort, sometimes pain. So when I'm describing prolapse, I'm like, I know that this is scary sounding, but I have to tell you what it is so that I can tell you that we can make it better. So like to know and to recognize is like the first step to then hopefully seeking treatment and learning to identify how you're feeling, which sounds simple like when I talk about it now, but it's not simple. It's hard. Learning how to recognize that you are experiencing symptoms and then being like, oh my God, I have that. And then hopefully getting treatment for it is the first step.
Right. So it starts with acknowledging it and then approaching
hopefully approaching. Yeah.
Hopefully approaching.
I think that's where like there's the big disconnect is that people have symptoms and then they can't approach treatment because we haven't provided it as an open channel almost anywhere. I do think that pelvic health, that women's health is improving, like the messaging around it is improving, but it's slow. It's really slow.
Right. When we talk about intimacy is one of the quietest shifts after birth. So for a lot of women, they feel that the body is unfamiliar physically, emotionally, or even sexually. So how do you approach a women who feel that the body feels different? They feel so disconnected with their body. How do you approach?
Again, it really depends on what they're approaching me, how they're approaching what they're looking to find out. Some people are like, I'm here because I didn't used to have pain with sex and now I do. And I'm like, okay, you sound ready to talk about this. But sometimes people come in and they're just there for their postpartum checkup. And we have to kind of discover that that's an issue. So it really kind of depends person to person. I think one of the most satisfying parts of my job is to take something that seems really scary and upsetting and breaking it down and being like, it's simple. Like, you don't have to worry. Like, we're going to fix this. sometimes, and like being like, the answer is not complicated. Like you can do this at home.
Right.
You can do this by just buying some lube. Like it's, sometimes people approach it and they're very distraught. And I'm like, oh, let's take like painful sex with insertion. So
Right.
there's different ways that sex can be painful, but oftentimes postpartum, it's painful like right around the opening of the vagina. And it hurts when something goes in
Right.
because it has to stretch.
Right.
So I'm like, if you've had an episiotomy and you had a grade 2 tear, and so you had stitches, maybe you also had like a vacuum or forceps or anything. Like there's a lot of physical recovery that has to happen in the tissues there. You had stitches, and since the stitches have gone in and healed, like that skin has not stretched,
Right.
not once, until you have penetrative sex. So if you were to approach any other area of scar tissue, like you just would never approach any other issue on your body the same way. You kind of look to the pelvic floor or look to sex as if it should be pain-free right after like this traumatic physical assault, basically, where there was like bleeding and like blood loss and tearing and stitches. Like it's a lot. So by breaking it down that way, it kind of eliminates the fear. And then people are like they're so much more relaxed. Like they'll come in, they're so upset. They're talking about, sometimes people cry because it's upsetting.
Right.
And then we break it down, and like by the end, we're like having a laugh. Like it sounds ridiculous, but we do. And you just like make it less daunting. You're like, all we have to do is we're going to stretch it out a little bit. I'm going to work on the scar tissue. Like that's part of my job. I can work on scar tissue just like I do after a surgery, like a knee surgery, work on scar tissue. And, we'll go from there.
Right.
So breaking it down, making them understand why it's uncomfortable, and then presenting them with actionable items that we can do together or they can do with their partner to make it better. And then hopefully they're leaving feeling way less anxious about it. And like that it's lifelong, that this is life now, forever.
Right.
Because I'm like, no, it's not. It does not have to be.
How can partners be a part of the healing process? They want to help the significant other, but they're confused. They do not know how. So how can they be helpful during the recovery process?
I think general society needs to do a better job at like talking about women's health and the recovery process overall. So that's a bigger issue that will take longer. I think also is helping. But if a woman is not able to understand her own issues first, then it's really hard for a partner to support her. And not that she has to tell them how to support her in every aspect. In their physical recovery, especially like around the pelvic floor or for intimacy, if they have a better understanding of what it is, like if it is scar tissue that's bothering them, then they can communicate that to their partners, and then I can give them actionable items to work on it together. So being able to talk about things, which again, pelvic floor therapists can help with, and then just simply communicating what their issues are can really help the partner assist them with that. Communication, basically.
True.
Yeah.
And for a woman who's already done all the basics and they want to go a little deeper, so what's that one powerful shift that you want them to focus on or incorporate in their daily life?
So I think if you've already done the basics, if you have spent time learning and addressing your pelvic floor or done any rehabilitation for it, like, kudos to you. Well done. That's a great first step. And I think deserves to be celebrated. I think the next thing I would say is to try to build strength. A lot of people are exercising with like body weight or light weights. I would encourage women to not shy away from getting into heavier weights. So to buying heavier weights or to trying harder exercises to really see what they can do, basically, because your kids get older, they get heavier, and ideally you're able to comfortably lift the weight of your child so that you can, because you will, so that those activities in your daily life aren't the things that injure you in return. My son is almost 3 and he's 37 pounds. So I should be lifting weights that are equal to or more than 37 pounds. And he's going to get bigger, like really fast. So not the 5 pounds, like going out and buying like 15-pound dumbbells, 25 like kettlebells, like, and if you need help doing that, that's what physiotherapists can do. That's what personal trainers can do. That's what we love to do. Right. Well, that's what I love to do. I love if somebody shows up and they're like, I'm actually feeling pretty good, but I don't know how to approach like this. Like, I want to get into this. I'm like, oh yeah, let's do it. Like, so, like try to push the limits, you know, like really see what you're capable of.
Right. It's very true. It's very valid. And to all the women listening to this episode right now, if you could leave them with one message about the pelvic floor or pelvic health, what will that be?
One message. I guess I'll just like kind of reiterate what we've already kind of discussed, but giving yourself the self-care that you would want your children to have. So if you looked at your loved ones and you knew they were struggling with issues that affected their self-confidence or their body image or their relationship with their partner or with themselves, and you were like, oh, like that's sad. I'm sad that that's happening for you. I hope that you go and seek treatment for that to make you feel better. I hope that women will do that for themselves, to take time and to spend resources on themselves because they deserve it, to show up for themselves, but also like for their kids in the future, for their relationship, for all of the things in their life, and just simply for themselves. Like, you deserve the time and energy to put into your own recovery, because it's a big thing you've gone through. I think too, it's like, that's another cultural thing, is like, well, women were born to give birth and women were born to have babies. It is really hard for humans to have babies, especially compared to like other animals. It's big. We have babies have big heads. We have smaller pelvises. It's a big deal. So spending time for yourself, for your own recovery, identifying and addressing issues that you're having. That's what I want. Like, that's what I want people to do. I would love if everybody did that.
Right. Women should give themselves some credit.
Huge credit. Yeah, totally. Right. I have to remind myself to do it as well. So it's not like I'm, doing all the things all the time, but like I'm the person advocating for that, and I have to convince myself to do that sometimes as well. So, as like a very outspoken pelvic floor therapist, that I have to remind myself to do that. I know it can be hard. I can imagine it's very hard for everyone to do that. So I guess that would be my hope, my message for people.
Thank you so much. That pretty much brings us to the end of this episode. And pelvic floor it holds more than what we talk about: the stories, the emotion, the profound resilience and cultural silences. And thank you, Tara, for sharing your wisdom and helping us have this conversation in the first place. And to all of you all listening to this episode right now, I hope this episode reminds you that healing is not just physical, it's human. So give yourself some credit. And until next time, take care of yourself. I'll see you soon. Thank you so much.